Hello everyone, good evening, and welcome to episode 3 of our global podcast. I'm Dr. Hossain Al-Amin, a public health specialist, and today we are taking a deep dive into Indonesia, from Africa to Indonesia in our podcast 3. And in this episode, we are honored to shed light on the extraordinary youth-led initiative that are revolutionizing sexual health education and services in Indonesia. And this initiative is spearheaded by CRID-USA and Kambaii Health, and that innovation and commitment in tackling crucial healthcare challenges head on. And our estimated guest speakers bring a wealth of expertise to the forefront. We have our main speaker panel, Rizka, a pioneering midwife and public health researcher whose efforts have been instrumental in advancing the sexual health rights and access throughout the Indonesia. We have Mr. Wahyu Gito Putro. He is a distinguished lecturer of a medical school and health economics researcher whose insights basically illuminate the economic aspect of healthcare accessibility and affordability. So everyone join us. We delve into the inspiring journeys, obstacles, and dreams of these young leaders and uncover how their initiative are reshaping the landscape of sexual health education and services in Indonesia. And we have also some people who have joined from the Africa, Derek, David Soro, Dr. David, Nelson, Derek Uma. So they're also sharing their informations and they're also sharing their thoughts regarding this podcast topic. So I would like to go again. What is our podcast topics? Today we would like to talking about the empowering youth-led initiative for improved sexual health education and services in Indonesia. So thank you so much everyone who has joined the session, especially Mr. Wayo and Rizka from the Indonesia, and Dr. David, Nelson, and Derek Uma from the Africa. Dr. David from Uganda, Nelson from Kenya, and Derek from the Kenya. So it's a global platform right now, and I'm from Bangladesh. So thank you so much, everyone. So in our session, this is basically divided into the two parts. In the first part, we would like to know about the Indonesian, SRAs and sexual reproductive healthcare system and a lot of the questions. And the second part, Dr. David, Nelson, and Derek will share their experiences, and they would like to approach some questions to our guests so that we can, identify what's the global challenges during our topics. So thank you so much, everyone, again. So I would like to first go to our guest, Mr. Wayu. So I wanted to know about, can you provide me basically an overview of the current state of the sexual health education and services for youth in Indonesia? And what are the main gaps or shortcomings you observe right now? So if you just overview Mr. Putro so that we can knowing about what's going on right now in Indonesia. Yes, floor to Mr. Putro.
Thank you so much for the question and the opportunity tonight, Dr. Hossain. And hello for Nelson, David, and Derek. As far as I understand sexual health education in Indonesia, because do have a lot of focus on the subject, yeah. I am a health economics specialist, so I will go over it briefly and then effects from a health economic standpoint. We move forward to the first gap that exists in Indonesia society, particularly between early adolescent to early adulthood, is the taboo of sexual health education in the family and even in the social setting. Because as far as I know, the sexual health education should in a school curriculum. So this gap eventually influenced teenagers seriously, which led to dangerous sexual behavior. This dangerous sexual behavior influenced the total of sexual health problem, ranging from infection that transmitted from sexual activity to the dangerous one, which is HIV/AIDS. This statement really matches with the Indonesian ministry data that the cases of HIV/AIDS in 2023 rises to 16,000 new cases. So this is really insane, yeah, for the sexual behavior. In addition, about the sexual health program in Indonesia are often designed and implemented to the primary health center or primary healthcare, which is the country's lowest level of the healthcare. The services are delivered the community in the from promotive to preventive service like screening. And if we talk about funding, the funding for sexual health service come from both capitation and non-capitation fund. And then if we talk about the funding, capitation is from Indonesian National Health Insurance. We call it B.PH Kesehatan. The number of money based on how much people registered on the primary healthcare, and for non-capitation the funding is from Indonesian National Health Budget, which is the number of funding determined every year. In addition, the costs from the government through the capitation fund are regulated. The budget 60% from 60% is paid for health service and 40% paid for operational costs, including promotive and preventive effort. From several interview I have conducted, the use of capitation fund for promotive and preventive effort is only around 0 to 5%, while there will be a sexual health program. So I think Indonesia needs to improve by starting to focus more on promotive and preventive effort. However, if we've specified the sexual health service or sexual health problem to the HIV/AIDS, all I know, Indonesia received international grant from USA, and the number of grant reaches $309 million. And for the
Well, so I think I wanted to just not like interfere. I just wanted to adding let's say Mr. Wayu. So I think Nelson and David can providing some feedback. So we know
okay.
about the SRS problem, like so the sexual and the health related problem, especially the sexual health is there is a very much problematic in Africa, right? And in Nelson know about a lot of HIV/AIDS patients are there, a lot of sexual transmitted disease patients are there because in Africa sexual education is not most popular things, and it's really a burden right now, right? So, Nelson, I think Nelson can provide something if it is compared to the Indonesia to the Kenya. So, why you already provide that? So there is a no promotive preventive approaches there. There is also, some barrier, some bindings there. So, Nelson, can you provide, let's say, the what's going on in your country so that we can understand how comparatively good in Indonesia or bad in Indonesia than Kenya? Nelson, can you provide any feedback?
Yeah, thank you, Dr. Hossain. Uh, Actually, I've listened to what my colleague has just said on matters on Indonesia, and I can see the similarity when I do a comparison here in Kenya. I can give a context. When you go to the statistics based in 2022, you can see the pregnancy rate in Kenya was around 50% in Samburu. Samburu is a very remote area here in Kenya. It's actually in the northern part of Kenya where you find there are no facilities, and it's a very remote area. And then that comparison, that 50% goes down up to 5%, which is in Nyeri County, which is a bit developed. So when you kind of compare these two statistics, you find that sexual education is very limited when it comes to remote areas. That is where we don't have access to this information. Yes, we have the community there, but then the information is very much limited. I want to say that still the government is trying to push for sexual education. We have so many programs that try to push education for sexual and reproductive health, specifically for the adolescent age group. We have so many NGOs. We have a good example is the Family Health Option Kenya, which is actually doing a very good job to champion this opportunity. We also have clubs in universities that are trying to champion this cause. So I can say we are not
Well,
there yet,
yeah,
but
yeah.
we're trying.
Yeah, that's fine. That's fine, Nelson. So, this is very good. So, I just back to David after talking with Rizka because Dr. David has joined from Uganda. So, we just provide a global platform so that we can know about what's going on the same topic. So, Rizka, basically, you are working as a very the crucial part as a midwife, because it's a very important part, and you are a public health researcher. So can you provide us some information? So what's going on in the field level? So on how many complications has developed during the time of the pregnancy? And is
Mm.
there really sex education can be possible in the Indonesia? Because some religious, matter also developed there, right? So can you provide what's going on in the field level so that we can enlighten what's going on in Indonesia in the field level care? Yeah, Rizka.
Yeah, yeah. Thank you, Dr. Hossain, and thank you for the inviting us to speak in this night. For me, sexual health education and services for youth in Indonesia, especially in pregnancy, is very important, and have seen some progress. Yet notable challenges persist. This include consistent implementation of comprehensive sexual education in schools, cultural, religious barriers leading to stigma, limited access to youth-friendly health services, and disparities in digital access to accurate information, and also complex legal frameworks. And gender inequality contributing to barriers in accessing services, especially in public health service. Addressing these issues necessitates a comprehensive approach involving government policies, community engagement, education reform, and efforts to combat stigma and discrimination, ensuring inclusive, culturally sensitive, and evidence-based sexual education programs to promote healthy attitudes towards sexuality and improve access to services for all youth. So I think, yeah, sexual education is important for in Indonesia since adolescent, but in Indonesia is lack of the knowledge and lack of the understanding and having stigma, discrimination. So is it the lack? Is it the hard to give some strategies to provide how to sexual health education is implementing in Indonesia better than others, like
Yeah,
culture.
yeah, exactly.
Yeah,
Yeah, because some barrier was there. So,
yeah,
Rizka, this is very important because, and what I would like to know, what motivation that you have to come in this field? Normally, what's going on, as a female, normally in the world, what's saying, let's say it's a very challenging job, right?
yeah,
You are a public health
yeah,
researcher, work on the SREs, work as a midwife, and you have counseling many person, and you can
yeah.
providing some technical support to many of the fields. So why this career you are choosing? Because it's very challenging. Can you share your story why you are choosing this career?
Yes, as a midwife, my motivation to engage in youth-led initiative focus on sexual health education because I am HIV researchers also. And
Right.
also I'm HIV activist in Indonesia, often arise from a blend of comparison, social justice, personal experience, and a dedication to empowering young people. Individuals driven by a passion for public health recognize the profound impact of sexual health education on individuals and communities. Those aspiring for social change aim to address inequalities, healthcare, and education, advocating for reproductive rights and challenging stigma. And also personal experiences with sexual health challenges or witnessing other struggling feels desire for action, especially to improve access for marginalized groups like a risk group, like LGBTQ plus, and also to advocate for their rights and drive positive change within communities. And finally, a commitment to education underscores the importance of providing accurate information to enable informed decision and promote healthy lives. So I think this is all the motivation of me to improve the sexual health education, especially in adolescents, to uh, to reduce the stigma.
Wow, nice. So thank you so much, Rizka. I'll get back to you. So as we have another expert from Africa, Dr. David. He is a medical practitioner and he is a physician. So Dr. David facing a lot of people, especially regarding this kind during his primary care physician visit. So Dr. David, can you share from your end how many patients you have received that kind of the problem? and how the sexual health educations has been promoting in Uganda. Can you share your some experiences?
Yes, hello.
Hello.
Yeah, you're audible, Dr. David.
All right. Thank you so much, the team from Kenya and Indonesia. I'm Dr. David, a practicing medical doctor. The landscape on sexual and reproductive health in Uganda is not far different from in Kenya, but as a country, we are making some strides in the area of sexual and reproductive health. The challenges are mostly because recently we have seen trends whereby the prevalences of HIV and TB increasing more amongst the adolescents, girls, with prevalences almost twice or thrice in some region compared to boys. But the intervention of the government is more on facility-based sexual and reproductive health services. They are not considering that Uganda almost 70% of the population are below 30 and they are young and they're in schools. So when you don't target these services to the right audience, that is young girls and boys at school, we see rise in HIV and TB, increased number of teenage pregnancies in school. Actually, when you attend the antenatal clinic, half of the patients you see are below 20, and when you ask them, they didn't plan for the pregnancy, and most times the fathers of the children are not in the picture. But if we offer and educate them on sexual and reproductive health, we shall capture this market, reducing the prevalence of HIV and TB and unwanted pregnancy.
Well, thank you so much, Dr. David, for your feedback. I'll get back to you very soon. I just wanted to go to Mr. Wahyu. Wahyu is as a teacher, he's a motivator, he's an instructor, right? He's a medical university teacher in Indonesia. He is also the public health researcher working on the health economics. So, Wahyu, I wanted to know about, so as you are the young leader and you have a lot of the students, and I wanted to know, are they aware about the sexual health education? And is there any kind of the approaches that you are taking from your medical university or any kind of the organization so that the barrier are removed? So any kind of the experience that you have on the sexual health education to your students in Indonesia?
Yeah, actually, in the university especially, we have some program to deliver health, especially sexual health education. Yeah, but in Indonesia especially, the problems come from junior high school. So if you ask me about the university student, especially in my university, I give them lecture about how sexual health should be important, and maybe yeah, I mean, I teach them to promote to others in a social even, like we call it in my university community medicine place. So
Right.
at the community medicine place, we collect the community, and we give some information about sexual health education.
Well, so I have another question to you. You know, there is a cultural norms and social attitudes. This is very important. So, how do cultural norms and social attitudes impact the effectiveness of sexual health education program in Indonesia, and particularly those led by the youth? You know, how it has been, impact, especially the cultural norm and societal attitude, especially to the effectiveness of the sexual health education. Any idea about that, or any,
Yeah,
experience?
yeah. Sexual education remain a highly controversial issue in the society until now. And I think peer educators are required to help young people learn more about sexual condition that may impact their sexual behavior. Besides, the majority of parents nowadays are from the baby boomers, you know, the baby boomer generation born in the 70s, and this influenced that the belief that sexual education should not be given in the family, also in the school, This mindset eventually leads young individuals to seek sexual information without direction and resulting in dangerous sexual activities. And sexual education activity organized by young people or by teenagers are the answer to this problem. As I know, there are several NGOs in Indonesia that works on teenagers, especially teenager sexual health. This includes what Rizka did in Yogyakarta, which created a special HIV/AIDS program with free counseling service for teenagers. And as I understand, the results of the program have had a good impact because many teenagers finally dare to talk about their risky sexual activities and finally get input as an effort to prevent their behavior. Maybe Rizka can talk more about her program
Yeah.
in Yogyakarta. Yeah.
Okay.
Yeah, so I just back to the Rizka. So Rizka, can you share me about what kind of the program are running in Indonesia? And let's say it may be the midwife program, it may be the SRS program in school, it may be the SRS program for adolescents, right? So I wanted to know what kind of the program right now are in running in the Indonesia, and what do you think? What's your plan? What kind of the program is being the places that will be more beneficial for your people? So can you please share your experience on the program that is happening in Indonesia?
Yes, thank you, Dr. Hossain. And before I share my program, I want to share how why I do some project in Yogyakarta like peer education program and mix with technology. Because I think technology and digital platform offer valuable opportunities to reach Indonesian youth with sexual health information and services, especially in Indonesia. And I did some surveys with adolescents, and online portals, telemedicine services provide easily accessible information and confidential counseling. Social media campaigns facilitate education and discussion, while digital storytelling platform foster empathy and support. Online peer education programs and mobile clinics equipped with telemedicine for counseling further increase accessibility, bridging gaps in service provision. And leverage these digital tools effectively empowers young people to make informed decisions about their sexual and reproductive health, ultimately promoting healthier outcomes. And I want to share my project. I'm involved in an HIV service project. This is my PhD project. And target at adolescent in Yogyakarta City, Indonesia. I operate under the media website, namely Extreme. You can access www.extreme.org. Maybe I can share screen.
Sure.
Okay,
Yeah,
I want
you
to.
can provide the chat in the chat box so that we can
Okay.
after the session we can discuss. Okay, yeah, move on, please.
Okay. Yeah, you can access www.extreme.org. The services offered by Extreme and Kambaii Digital Health and Peer Education mix both of them, including education services, counseling care, risk screening assistance, guidance in locating HIV testing facilities, scheduling of HIV tests, and reminder notification for adherence to antiretroviral therapy among people living with HIV, but especially in adolescents. And I implemented in schools, in senior high schools, about 400 adolescents. And also this project supported by school and the health office in Yogyakarta and education office in Yogyakarta. So I think this program not only about the adolescent, but also to improve the health system in HIV prevention in Yogyakarta City and Indonesia also.
Well, Rizka,
Yeah.
what I have planned right now, because it's a collaborative platform, and right now you see from the Kenya, from the Uganda, the response are joining. So, if we have planned for the this as a global online platform because HIV/AIDS is mostly endemic also in the Kenya and the Uganda. So can we arrange some kind of the training program? Let's say it may be the combined training program. Let's say Dr. David can provide training to your participants, and Rizka and Wahyu, you can provide training to Kenya and some other countries. So if we are arranging and organizing from Kambaii Health as we are collaborating this, so what do you think?
Yes,
Is it beneficial for all, right? Exactly.
yes,
So
of course, Dr. Hossain.
I just go to the Nelson. Nelson, can you share your experience? Let's say if we are organizing that kind of the comprehensive collaborative program, not only Indonesia, Kenya, Uganda, a lot of the peoples are come to our global platform. And let's say world is right now is a very smaller. We are talking in a different country in a different states. So what do you think? Is it beneficial for your country if we organize that kind of the program?
Yeah. I think it's very beneficial actually because it will serve like a capacity building program to bring all the youth on board and possibly to use now the digital platform, which you've just said that has made the world to be more like a village. I think it's feasible if can work with the other team from those countries. Then we look for a program that is feasible. Then we can implement it together with Kambaii.
Exactly. And I just wanted to add, because the two researchers is here, Mr. Wayu and Rizka, so we can go for the joint research program also. Let's say we can find out the common title. So in the common title, we can see the variation, the same topic variation in Bangladesh, in Kenya, in Uganda, Nigeria, Cameroon, and Indonesia. So we can go for the comparative analysis. Let's say before the capacity building, what's going on, especially the sex health education awareness of to them after this online platform, what we have done and providing the capacity building, how this awareness has been developed and what has been impact in their social and cultural life or something else. So I think we can plan, it's a very good plan, I think, so that we can comprehensively going together around the world. Okay, so I have Mr. Derek. Derek Uma, can you hear us? Derek from Kenya, most probably. Derek, can you hear us?
Yeah,
Or can you talk, or we can? You couldn't.
okay, okay. Okay. Can you hear me? Hello.
Yeah, we can hear you, Derek. Yeah.
Okay.
Well,
Can you hear me?
Derek. Yeah, Derek. Derek is also a very good person.
Okay. Okay.
From Kenya, he has joined. So, Derek, can you provide, how we can connect the SRS education to your country? Can you provide any kind of the feedback that we are discussing right now?
Uh, Sorry, I didn't get you clearly. Uh,
I
can
think
I
I think
provide
Derek,
about?
we can. Yeah, I just make it very simple to you, Derek. We have planned
Hello. Can
for
you hear
a
me?
joint Yeah, Derek, I think there is an internet connection problem. I just get back to you. I just
Okay.
back to Mr. David, David from Uganda. Dr. David, as you are a senior physician and you know what's going on in the Africa. So what do you think?
Yes.
As we have planned for the joint sexual health education program around the world, and we have the two good researchers from Indonesia. So how do you think this approach is beneficial for our society or not? What do you think?
Yes, as per the area of sexual, we need to first of all get the experiences, what they do, and probably some of the intervention we are doing in Uganda as a country, we shall also have an opportunity of sharing. And we start by building capacity. You see, sexual and reproductive health in Africa in general, there are few people championing it. And if we start by building our capacity, I might know, but I need a team, okay, to work with and to improve that. So if we have a global platform whereby in each individual country, Nelson can mobilize in Kenya a team, and then we share experiences from all countries, and that's how we can start expanding and go beyond where we can cover. Right now, I'm at a facility. I need the capacity to expand to other regions or other districts where I'm working.
Exactly, Dr. David. So I just back to Mr. Wayo. So, Wayo, whatever you heard talking earlier, that this is a comprehensive approach, and we need to connect the people as you have a lot of the medical students there. So, is it possible, Mr. Putro, to engage some volunteer from your medical school for that kind of the program? It's a global program so that they can mentoring also, they can learn also, and they can promoting their sexual health education to the field level also, and it's maybe also the part of their education. So, is it possible as a teacher of a medical school from your end to develop a team
Yeah,
that Dr. David has provided?
it's very possible because yeah, I already told you that we have a pilot project called it community medicine, and the HIV/AIDS, especially community building like this, really can improve um our focus, yeah, in a community medicine. So this is very possible for our student to give some capacity building, or maybe internationally. Yeah.
Right, right. So because what we have done earlier, because we have already developed a team and we have a team in Kenya, we have started a team in Uganda with Mr. Dr. David, because we also working as a Kambaii in Uganda and Kenya. So what we have planned right now, we would like to expand to the Indonesia, and every week we are connecting a new country. Nelson knows very well. We are talking earlier in the Cameroon and Nigeria also. So gradually, when we are getting all the country in a single platform, so we are getting the lot of research, we are knowing about the lot of capacity building training. So I think this is a very good initiative indeed. So I just get back to Rizka. Rizka, midwife is a part and parcel of any kind of the SRS care, right? During the delivery, pregnancy related complication, or anything else. So the role is very important as a midwife. So if we have planned to providing the capacity building training, especially for the midwives, and promoting them and training them such a way so that they can providing some early approaches or preventive approaches. So what do you think, Rizka? What is the midwife? How midwife is very important in this care? And if we are providing the training to them, and what do you think? Is it very good, beneficial to them or not?
Yes, is it very possible to you did some do some capacity building for midwife, especially in young midwife? Because today I with AIDS Commission in Indonesia, especially in Surakarta City, Central Java, we did some capacity building activities like training, yeah, for young midwife, and also for senior high school, and like peer education, yeah, peer-to-peer networks. And I think peer-to-peer networks and youth leadership is very pivotal and in advancing sexual health awareness and behavior change among Indonesian youth, especially in midwife, because midwife is very important role in pregnancy and
Right.
yeah, breastfeeding, and also and so on. So I think it's
Exactly,
very,
exactly.
yeah,
Right.
very possible. Yeah.
So what I have planned, so we can do it the training or capacity building session in the two way. One way, especially for the healthcare provider, and one way which only is other than healthcare providers. So let's say we can promoting the medical students, the school student, college and university students, so that they can providing the awareness program and health educations via social media and on-site, and other things who are basically connected with the patients, especially they need the technological support and they need the clinical support. So that will provide it like Dr. David, the experienced physicians who can providing the training from Uganda, right? Well, so I just go to Derek Uma. Derek, I think you can hear me right now. This is fine, right, Derek?
Yeah, sure, I can hear you. Can you hear me?
Well, Derek, can you please introduce yourself, and how we can connect uh, and approaching the SRS education or sexual health education in your country and globally? Can you please provide your feedback during this discussion?
Okay, thank you so much. So, first of all, I'm Derek Ouma. Yeah, I'm a finalist at Kenyatta University. Yeah, and I'm a medical lab student. And of late, throughout my studies here, I developed, interest in research to be specific. Yeah, and I've been undergoing series of training. Yeah, So first I said I went through HAPPY training. That's Health Education Partnership Initiative. Yeah, and then I went through AfriHealth FEMA, interprofessional training. Yeah, that's in Africa. Yeah. So and basically under this topic of sexual education, yeah, I had one of the colleagues say, in Indonesia there are around 16,000, new infections from now that's HIV infections, yeah, and if I translate these figures, yeah, into our figures, in Kenya, I'll say, infection is always on the rise, yeah, but there are still mitigation, patterns that have been taken. So of late, we've recorded quite, not so high increase, but it's still, we still say, it's still high, yeah, infection rates in Kenya. So we say, no, there was a time the government actually tried to introduce sexual education, in formal schools, but there were a lot of, setbacks and challenges, and parents really denied it, and it was scrubbed off. Yeah. So there was some cultural hindrances, and, beliefs, and it, you know, the community didn't
Yeah,
welcome the
I
idea.
just got
So
your point, Derek. I think
okay,
there is a lot of point we can collaboration. So we just running out of our time. So we almost done. So I just
okay.
go for Mr. Wahyu. Wahyu, I just wanted to know what will be the challenges if we have planned for that kind of the work globally. What kind of the challenges may arise and how we can plan for combating this kind of the situation? Can you please elaborate something?
Yeah, maybe the challenge is um I think
If there is a no challenges, there is a no problem. No challenges means
yeah,
we will be
yeah.
successful very soon.
No. I think we don't have a challenges for running this collaboration. Yeah, the one that should be focused is our commitment.
Right.
So we can,
Exactly. Exactly.
yeah, yeah.
Exactly. I think commitment is very good. And for this commitment, different countries people is right now. All of the busy people. You are the researcher. Dr. David is a physician. Derek are busy with his work. Nelson is also working in the laboratory. Right? So, Rizka, I just wanted to know about the health-related innovation and technology. So, is there any kind of the technology or health innovation or approaching in your Indonesia? Let's say like some app, some electronic medical record system, or EHR. So, any kind of the integrated system right now belonging in Indonesia?
Yes, Dr. Hossain, we have some apps, many apps in Indonesia to encourage HIV services, but it's that only in documentation. We call SIHA. Yeah, SIHA is like a documentation for HIV patient or HIV people living with HIV for documentation about medical medication and also HIV testing uptake, coverage, and so on. But in my project, Indonesia, we don't that didn't have some screening risk for people in general population, uh, and yeah, we built some website and integrate each other like education, counseling, screening, risk population, and HIV testing coverage. And I think it's very important if we collaborate and link each other in other services. I think, yeah, it's not
Oh,
only
well,
education.
because that's right now what we can help. That's we as a Kambaii, we are providing the healthcare innovation and technology, and Dr. David knows very well because we have planned to initiate it in Uganda in his hospital or clinic. The basic thing is what we can do because it's very important to the detailed medical history, right? So when a patient come to you with us, we need to go for the detailed 360-degree history so that we can identify either HIV, it may be either maybe the clinical feature of cervical cancer, right? Either it may be any kind of the problem. So what we can do the capacity building, we can do the training, and gradually we can approaching to the healthcare technology because technology is very important right now. And when technology is there,
Yes.
we can belonging any corner of the world and seeing all the information and provided our feedback also. So I think that way we can talk and we can connect later on for the future enhancement. So I need to go again to Rizka. Rizka, it is very important to collaborate with some of your local or national organizations who are working this kind of the things. So if we are jointly approaching them, what do you think? Is it possible to connect with them and make these things happen nationally in your country?
Yes, I think it's very possible because several partnership and collaboration have been instrumental in supporting and scaling up youth-led initiative, especially for sexual health education, HIV services in Indonesia, and also Uganda, Kenya, and maybe Bangladesh. Because
Yeah,
collaboration with government agency, NGO, healthcare providers, we have many NGOs in Indonesia. So I think it's opportunity for this collaboration and also educational institution at like Mr. Wahyu and community-based organization, corporate sponsor, provide essential resources, funding, and
right.
institutional support. So I think it's
Yeah,
very
it's really possible. It's really possible.
yes,
When
yes,
there is a
yes,
global platform, you know that UNFPA is also working on the SRS program because UNFPA is very special for the program. So when we
yeah,
can providing the common approaches and the same title and the same module, same plan, just copy and paste implementing the different countries, and we are getting the result, right? Then we can comparative analysis. Then look, we can providing that kind of the initiative, so we are getting that kind of the impact. So if we get the good funding opportunities or some good investment, so we can change the world, especially the SRS healthcare. So we are almost done, and I just go to Dr. David again. So Dr. David, you are a very experienced person, so I just get back to you the multiple time. So what do you think, David? Is it possible to your country also to connect locally and engaging for this kind of the initiative to implement it globally and implement it to the Uganda? What do you think about the collaboration in Uganda?
Yes, thank you so much for that question. That collaboration is very possible, and as per the challenge, it's commitment of the members. And then we are like ambassadors to the different countries. If we strive to build capacity within our country, engage more people to get involved in such initiative, we shall really have a tremendous effect, both in all aspects, in all spheres of sexual and reproductive health, whether we are tackling HIV or unwanted pregnancy and increasing family planning services to our communities.
Right.
We find that most of I'm serving at a rural facility. The issue is information. Patients are not having this information. So if we give them the information, they will really uptake these services. You find that sometimes a patient thinks of traditional healers as their first point of contact for something which is medical because they don't have the information and the others. So
Right,
a
right,
collaboration at an international scale would be very beneficial, but as each countries, we need to build capacity, we need to create a team to ensure
right.
that this is achieved.
Exactly. So the basic thing is, in a today's discussions, what we are getting a lot of recommendations and suggestions. Number one, we need a global team, as we have right now. Hopefully, we can expand. We need a dedicated people. Second, we as we have a global platform, we can organize or arranging some CME sessions, some capacity building training, some on-site or online clinical certified training. And third thing is, as we are providing or planning for a same model, after that we just implement it into the different countries, then get back to our donors or some investors to connect them and show them the results. Look, we have the product, and right now this is happening. If we get the support, we can change the world. So I think this is all good recommendation. I just get back to my two guests right now. Wahyu and Rizka, provide your final opinion. What do you think? Is it good podcast for you, and how do you feel? Can you just share just some of your experiences, Mr. Wahyu? Is it good for you? First time joining in this session, Mr. Wahyu.
Yeah. Um, Once again, this is a very, very, apa ya, very interesting, yeah, opportunity to discuss with you guys about sexual education, especially in HIV/AIDS, especially in community building, and our plan to make it bigger. So maybe this station I will share to my student next morning. So thank you so much, Dr. Hossain, for inviting me this session.
Okay, thank you so much, Mr. Oyo. Rizka, can you share something? How do you feel?
Yes, I feel so wonderful. Yeah, it's very very fun in the night because Indonesia is in 10 p.m. now.
Okay.
So yeah, I think it's very insightful discussion, and thank you so much for the opportunity, Dr. Hossain, and nice to meet you, Dr. David, Nelson, and Derek, for the opportunity to and chance to collaboration, because in Indonesia, I think it's a few researchers in HIV. So I want to scale up my program in international scale. And yeah, as a researcher, as a midwife, it's very important for me to connect each other. So I think after that we can link each other in other projects.
Yeah, it's just a start. So it's just a beginning. So we just start the program. So hopefully we'll continue and connect the whole world. Thank you, Mr. Wayu, Rizka, Dr. David,
Thank you.
Nelson, and Derek Uma. So finally, as we draw this episode to a close, we extend our deepest gratitude to our listeners for joining us on the enlightening exploration of Indonesia's youth-led initiative in sexual health. Our heartfelt appreciation goes to our distinguished guest speaker, Rizka and Wayu, for generously sharing their expertise and experiences with us, and their passion and dedication serve as a guiding beacons in the ongoing quest for improving healthcare access and education. And we commend the efforts of CRID-USA and Kambaii Health for providing this platform. And as we conclude, let us carry forward the lessons learned and the inspiration gained from today's conversations. Together, let us continue to support and amplify youth-led initiatives, hopefully fostering a future where health quality and empowerment reigns supreme. Thank you for turning on. Until next time, stay informed, stay engaged, and stay inspired. This is Dr. Hossain Al-Amin signing off from Bangladesh. Thank you so much. Those guys are joining from Indonesia, from Uganda, and from Kenya. Hopefully, one day, 193 countries in a single and a global platform. Thank you so much. Have a nice day and have a nice night. Goodbye, everyone.
Bye. Thank you so
Thank
much.
you.
Thank you so
Bye.
much.
See you later.